In the early 1930s, medicine was desperate to find a way to calm the chaos of the human mind. Mental hospitals were overflowing, and doctors had few real treatments. Just confinement, shocks, and despair. Then came a Portuguese neurologist named Antonio Egas Moniz, a man both curious and dangerously ambitious. Moniz had heard of strange experiments on chimpanzees. Scientists had damaged parts of their frontal lobes and watched the animals grow oddly calm, as if their wildness had been erased. He wondered if he could do the same to people, cut away the madness itself. With no scanners, no maps of the brain, and only his confidence as a guide, he began drilling holes into the skulls of living patients. He even injected pure alcohol into their brains, burning away tissue to quiet their thoughts. Later, he invented a small wire tool, the leucotome, to slice brain connections more neatly. For a short while, he was praised as a genius. But his invention would soon be taken to a far darker place. Across the ocean, an American psychiatrist named Walter Freeman heard of Moniz's work, and decided to make it faster, easier, and, terrifyingly, more practical. He wanted a method that any hospital could use, even without surgery rooms. So he found a shortcut, through the eye socket. Using what began as an ordinary kitchen ice pick, he slid it under the eyelid, behind the eyeball, and tapped it with a hammer through the thin bone of the skull. Then, with a twist of his wrist, he sliced through the front of the brain, the part that controls emotion, decision-making, and personality. He called it the transorbital lobotomy. There was rarely anesthesia. Freeman would shock the patient with electricity just long enough to knock them unconscious, then begin. The whole thing took 10 minutes or less. Nurses fainted. Onlookers applauded. Freeman performed these surgeries everywhere. Hospitals, offices, even on stage. Sometimes, he did 20 or 30 in one day, moving from one victim to the next like a man possessed. At first, people thought it was a miracle. Patients who had been violent or suicidal became quiet and docile. Families celebrated, until they saw what was left. Many came back blank-faced and slow, like ghosts of their former selves. Some forgot how to speak or eat. Others sat staring for hours, smiling faintly at nothing. A few died on the table. Those who lived often lost what made them human: the spark, the feeling, the memory. By the 1950s, new psychiatric drugs began to show what real treatment could look like. The lobotomy was finally seen for what it was, a tragedy disguised as science. The medical world turned on Freeman, and he died in disgrace. Today, the story of the lobotomy stands as one of the darkest chapters in medical history. A warning of what happens when human curiosity loses its conscience. It is a reminder that the quest to fix the mind can sometimes destroy it entirely.